as part of an investigative team, we're like, you know what I mean? And you get like zoned in exactly about what needs to be done about your particular job, but it's the center that creates and fills in all those gaps otherwise. And we've never been able to get it out, you know what I mean, to really explain it to people. And I know that that's been a big limitation to us being able to move forward and get more funding and get a building, because we just can't explain it well enough. I remember last year, it was Christmas time, and we had a really bad case come in. It was the day of the CAC's staff Christmas party. So I knew calling Sherry what I was calling to ask her to do, and there was absolutely no hesitation, and they stopped their staff party and we all showed up at the CAC, and they made sure that the child had what the child needed, and there was no grumbling, there was nothing. We called and they answered.
The wonderful thing about the Children's Advocacy Center is that they're never going to turn a child in need away. But because of that, it's sort of tightened the reins on some of the services that they're able to provide. I think a new building for the Children's Advocacy Center would further help their development and expansion of services.
I see it firsthand. There's generational abuse, generational neglect, and the same families are constantly coming to our attention. The ultimate goal and model of the Child Advocacy Center is to have all of our agencies that are involved in these cases co-located together so that we can work hand in hand. We can easily and quickly share information across the disciplines to really make these cases successful. If you don't have that coordination at times, families stop cooperating. Not because they don't want to be cooperative, but because they can't.
As a mother and as a pediatric emergency medicine physician, I feel it is very important that we have the right services in place to help these families through this process.
We need to keep pushing forward until we can stand up together and say that these kids are our number one priority and that we've done everything that we can do in this community to keep them safe. We are so fortunate to have had the leadership, the guidance, and the vision of Rod and Dee Dee Smith, and we wouldn't have a center if it wasn't for the commitment of people just like you in this community. The Child Advocacy Center staff and board has been working hard to identify just the right building for the Child Advocacy Center's home in this community. We have been working with Gary Moody and Shelley and Tony Salzman for the privilege of being able to purchase their building. $200,000 gets us in the door. We have many miles and dollars to raise beyond that to make sure that this vision is a reality for children in this community, but we can't do it without you.
Those of you that know me know that I hate asking for money, but tonight I'm going to do it. So all that we ask is that as soon as this video ends, visit jaysplace.org to make a pledge or a donation.
There was a child who came into the center and she walked in and she said, "This place is like a home." And initially I thought, oh my gosh, you know, because it's still an office. I said, wow, if this feels like a home to you, where have you been? And two, wow, we've done a good job.